So good morning, everybody, and welcome. My name is Jenna Sistad, and I'm with the Ocean Monmouth Health Alliance. And right now you're joining us for our Health to Hold Community Resource webinar series. This is an opportunity for our coalition partners to highlight all of the great work that they're doing. And we typically hold this meeting once a month on the fourth Wednesday at 10 a.m. So we're very excited to be here, and I want to welcome you. Today with me, we have a few of our team members. So I'll ask Diana and Marlene if you would just take yourselves off mute and introduce yourselves from the OMHA side.
Marlene, you go first.
Good morning. My name is Marlene Alvarado. I am the bilingual community health worker for Ocean Monmouth Health Alliance, and I work with Jenna and Diana.
And good morning. My name is Diana Rios. I'm the Health Equity Resource Coordinator, and I also work with Jenna and Marlene, and I do COVID awareness and information and education as well.
Excellent. Thank you both. So this is our Ocean Monmouth Health Alliance team. For those of you who may be newer to what we do, we are the Cancer and Chronic Disease Prevention Coalition for our region. We cover both Ocean and Monmouth County, and we do things like education, awareness, advocacy, COVID, like Diana said, and navigation to resources. So just a couple of housekeeping rules before we get started. We will be doing a question and answer session towards the end. So if you have questions in the meantime, you can feel free to put them in the chat. Diana will be overseeing that. And if you wouldn't mind putting your name and your contact information into the chat box, that would be helpful as well, so we know who's here with us today. And you know, depending on the group size later on, we might ask folks to unmute themselves to ask questions during that time. But for now, please keep yourself on mute. So please let me be the first to introduce to you our friends at Amerigroup. I don't know who's going first, but we have Wanda and we have Marianne. So welcome and thank you for presenting with us today. We can't wait to hear from you.
Thank you so much, Jenna. Thank you for inviting us here today to be able to provide information
Wanda,
on our
can I
program.
just give a little instruction before we get started?
Oh, absolutely.
That's okay. Can everyone hear me? Thumbs up? Okay, great. Can I ask before we get started, if everyone, if you can turn a piece of paper over, draw a picture of a pig. A pig. A little pig, a little animal, if you can draw a picture of a pig. And we will talk about it a little later. So while you're kindly listening to Wanda,
whoever's speaking, you're breaking up terribly.
Pig picture. I'll take it, give it over to you, Wanda.
Okay. Voy a traducir lo que dijo Marianne.
Okay, is this better?
That's better, Marianne.
Is this better?
Yes, it's
perfect. And can I just ask another question, Jenna? Do we have any? We'll do Spanish and English? Yes.
I think
Great,
I think right now we only have English speakers. Marlene will let us know if somebody joins that we have to make the accommodation for. So for now, English would be great.
Oh, fantastic.
All right, thank you.
Okay, Jenna. So if everybody drew whenever everybody's ready, if they go ahead and draw their pig, and then they could draw the pig while you guys can go ahead and draw the pig while I start the presentation. Okay. Marianne's going to come back to that later and during the presentation. Okay, here we go. So my name is Wanda Bronner with Amerigroup Health Insurance, and today I have my coworker Marianne, our health educator, also with me to assist me during this presentation. I just would like to let you know that Amerigroup New Jersey is a New Jersey family care insurance company in New Jersey that helps children, families, pregnant moms, and adults get the health insurance from the state. We've been in business for since 1996, and we are very big on providing more than health insurance to the community and our members. We are growing to do the whole health, so go beyond health. So we're doing food distributions and diaper things and much more. So we can move on to the next slide. So what is New Jersey Family Care? I know most of you know it, but I'm just want to make sure that I go through it. So New Jersey Family Care, who is eligible? Children under the age of 18, absolutely eligible. If they have 1 day of green card, like a minute of green card, they're eligible. Okay, as long as they're under the age of 18 and they're under the income guidelines shown, I'll show you in the next screen. Pregnant women are eligible, whether they have papers or not through labor and delivery. And if they do have papers, documentation, they're able to select an HMO as well. Adults are eligible from the age, so what's considered an adult? 19-year-old. So college kids are considered adults now once they are 19 to the age of 64. So that goes together. Those guys have to have 5 years of green card to be eligible for New Jersey Family Care. And I have here the pregnant women that I just went through. I just want to say it one more time. Pregnant women are eligible if they have a minute of green card, 5 years of green card, or if they don't have any paperwork, they'll still get labor and delivery. If we can just move on to the next slide. And I don't know, I'm going to go over this slide and then I'm going to stop for questions. So to give you guys an example how this income guideline works, basically, I'm just going to give you a standard family of size 4. So 2 adults or 2 kids or 1 adult and 3 kids, that would make a family of 4. So for mom and her 3 kids or 2 adults and 2 kids to get New Jersey Family Care, the income guidelines this year for, oh, I'm sorry. This income guideline is from 2021, so I apologize for that. The income guidelines right now have actually gone up to about, it's a little bit higher than this, okay? And I apologize, I have the wrong slide in here. So for a family here, thank you, Margie. For a family of 4, every year, this is a good point to make actually. So you see how errors happen that sometimes are beneficial. I just want to let everybody know every year New Jersey Family Care increases the income guidelines. So last year, as you can see, for a family of 4, it was $3,048. This year, it's $3,192. So it went up $200, or $150. But it could mean the difference of, hundreds of other families getting it this year. So for a family of 4, $3,192, all income is included, unemployment is included, SSI is included. What else do we have? Anything that you're getting income is included. Because I know sometimes people say, oh, but I'm not working, so I'm really just getting this unemployment. Well, it's your income, they include it. So let me just go through here. For all 4 people to get it in the family of 4 that I said, $3,192. Pregnant moms, there's a different, you see the column in yellow? There's a whole bigger column for pregnant women. The state wants to cover pregnant women. So for a family of 4, now, mind you, pay attention to this one. It's a family of 4, but mom is pregnant. You push down to the next column, which you count the unborn child as a 5th member of the family. So you increase it by 1. So we would go down to the column that says 5, so family of 5, and that would be 5,547 this year, which I know that you can't see that because I'm using the wrong income guidelines, but that's what it is this year. So it does give the opportunity to pregnant moms that have higher income to be eligible for the program. Another thing I want to say about pregnant women and insurance, if they have insurance that is privately through their work, but it doesn't cover a lot of things, they can apply for New Jersey Family Care secondary. They will get it while they're pregnant, and 2 months after they deliver, and it will cover whatever their primary insurance doesn't cover. I always ask moms that are pregnant, do you have, I have primary insurance. Oh, no. But if you're under this income for a family of 5, 55, 47, I recommend you apply. So that's pregnant women. And then the rest of the column that says children under the age of 19, those are, let's go back to family of 4. So I'm just going to use this, what's noted here, family of 4. As long as the family is over 3247, which actually the actual income guidelines now is for a family of 4, it's actually $3,400. So if the mom makes over $3,400 for a family of 4, only her children will be eligible. During COVID-19, the governor did cease to provide to charge people premiums. So that's fantastic, because a mom of 4 that is making $7,000 is not paying a premium right now. I do not know if they're going to keep this once the public health emergency has ceased to exist. So when they turn that off, I'm not quite sure if they're going to continue not charging premium. I hope they do. That's all we can hope for. So that takes care of that. Jenna, we can go to the next slide, which is basically in Spanish. And I guess if there's no Spanish speakers here, we can skip it and see if there's any questions.
Hi, Wanda. This is Diana. Someone does have a question. They want to know, what about people with disabilities?
So yes, absolutely. When I did mention the word SSI, I thought to myself, oh, I do believe SSI is included in income. Are we asking, what is the question? I'm sorry. People with disability, are they eligible for?
I think it's Social Security disability.
Yeah. Oh, what about people on Social Security disability was the question? Okay.
So people that are on Social Security disability, it depends how they get it, because sometimes you get disability before you're 65, and there's a 2-year, so there's a 2-year period that you may or may not get Medicare immediately. So people get disability, sometimes they have to wait a 2-year period for them to get Medicare. So if they get Social Security disability and currently do not have Medicare, this is the income guideline that's going to get used for them, and they can apply for New Jersey Family Care because they don't have Medicare. But the minute that, let's say their 2-year wait is over, and then they're provided with Medicare after the 2-year period, they cannot apply through the regular means of New Jersey Family Care. They have to apply through it's actually called Medicaid, but it's not this income guideline. It's called Aged, Blind, and Disabled Medicaid. And I do have, there is a template that I have that if any of the CBOs here today would like information on that, I could definitely forward it to you. It's the application from the local Board of Social Services. In this case, we're in Monmouth County. So you would need to complete it for the Monmouth County one and send it there. But the income is very low when you have Medicare, and they only count family of 2, unfortunately. So even though you may be a young adult and have 3 kids, a family of 5, but you have Medicare, they count only, it's very low income to get Medicaid secondary. So I hope that was able to answer that question without.
Wanda, can you also talk about the Ocean County process? So yes, we have some folks from Monmouth, but if it's the same application process for the families in Ocean, could you mention that too?
Thank you, Jenna. So yes, it is actually the same application, except that on it, it would probably say Ocean County, say please mail, because you could do it online through New Jersey Family Care. The minute you answer the question, are you 65 or over, on this New Jersey Family Care website, or you put down that you have Medicare, it flips you over to this application called Aged, Blind, and Disabled. And you could do it electronically. I gotta tell you, electronically might be a little more painful because it's timed, and if you do any errors, it'll like blank it out. So I usually recommend that people do it on print the application, do it physically, and then you have like more time, because it's not an easy application. It's like 13 pages, and it asks you everything between like, do you have, death insurance? Do you own a home? Do you get income? Do you have jewelry? It asks you everything. So it's much harder to get the Medicaid for aged, blind, and disabled than it is for the regular New Jersey Family Care participants.
Great. Wanda, the secondary question to the SSI disability is, what if you have Medicaid and get SSI disability? Is that money included?
So Medicaid is the insurance, right? But SSI, oh, I think I know what the question is. So once somebody gets SSI, they get Medicaid through the Social Security office, not necessarily through New Jersey Family Care.
Okay.
It's the same insurance, it's just where you get it from. So I can have an SSI participant that maybe is new, or I don't know what the issue may be, but they did not get their SSI through the Social Security office. They can apply through, the regular New Jersey Family Care and get the same program. The benefit to having Medicaid through SSI is that they don't renew you every year. They renew you from, depending on whatever your disability is, from 3 to 5 years. So that's the benefit of getting it through SSI. I hope that was able to answer that question.
Yes, she says, excellent, thank you.
Thank you. Okay, so if we can move on to the next slide. Okay, how to enroll into New Jersey Family Care. So basically, as I mentioned earlier, we do have the local Board of Social Services in 21 counties. So residents from that county need to register. They don't need to, I'm sorry, but it's an option. You could go down to your local Board of Social Service and apply directly through them. But the easiest way to apply for New Jersey Family Care is to do it on the website. So, and actually, as long as I'm talking about this, the reason we're here is because I work with Amerigroup, and Amerigroup has, we have a team of reps that do assist members with New Jersey Family Care. We've been doing it for a very long time, so we're very good at it, and we're up to date on all of the different innuendos that we need to know about different things with the website, or just what the New Jersey Family Care is asking for and things like that. So this slide does cover, just tells you that that's where you can apply directly, but we would love it if families would reach out to us so that we can assist them directly. We do it over the phone. We provide them with, the next steps that are coming. That way they don't miss anything. And we send them a confirmation as well. So that's how to enroll for New Jersey Family Care. We can go to the next slide, and then we can ask for questions. This is a very good one. We still don't have any moms, any parents in the presentation, Marlene or Diana?
No.
Okay. So this would be for our customers, keeping baby covered. So once mom gives birth, whether she is receiving labor and delivery because she doesn't have her documents to get New Jersey Family Care with the HMO. So whether it's labor and delivery, or whether she's getting the Pregnant Women's Program through New Jersey Family Care, which does cover the HMO. Once she gives birth, it is very important that she reaches out to it's two different scenarios, right? So if she has an HMO, she has to reach out to her HMO, be it Amerigroup, whichever the case may be, and let the insurance company know that she gave birth, and the baby will be clocked in as being, born with the mom has to provide the full name, birth date, and gender, and that gets put in. The mom only gets 60 days when she has the HMO. She gets 60 days to call either the local Board of Social Service or the state, right? Because New Jersey Family Care can be on 2 different levels. It could be county-based, as we said before, or it could be in the state level. And really, it's just a matter if the mom has, if you guys have the policy number, the New Jersey Family Care policy number, if it starts with a 1 through a 21, it's going to be a county case. If it starts with a 23 or a 24, and mind you, these are 10-digit numbers, it's going to be with the state. So it's very important to let our members know that once they give birth, did you call the insurance company if you have an HMO and let them know the baby was born, because that's important. And then the next thing they have to do is figure out whether their case is in the county or their case is in the state. Reach out to either that county or reach out to the 1-800 number, which I have further in this presentation, and let them know that the baby was born, because the baby needs to be added to that mom's policy. If the mom does not, only has labor and delivery, she still has a case. So she's going to still reach out to the local board of social service and say, I had a baby. You need to provide the crib card and or bracelet if you don't have the birth certificate and social right away. And I do want to say that, guys, of course, the county does want you to send a copy of the social security card and the birth certificate, but sometimes that takes time and the baby needs to have insurance immediately. So they will allow a copy of the crib card and the bracelets as proof of birth, or even the discharge papers. So I just wanted to make that note. This is why this slide is so important. And I just wanted to share that. Okay, next slide. Or questions, I'm sorry, is there, well, here, let me finish this slide and then we'll open it up to questions. So here is what I was mentioning. This is what I was saying about the information. You can have a case at the state level, which would be the Trenton, New Jersey. There is the phone number listed there, and there's the fax number if you need to send supporting documents or just even call them. They always answer their phone because they have thousands of members to do, thousands of reps to do this. And it's the best way when you're unsure of, if you have a county case or a state case, I would always say call the 1-800 number 7010710, because if the case does not belong to them, they'll say, oh, your case is not here, but it's at this county. And then they'll give you that information and they'll give you the case number so you can follow up. I put down the information from Monmouth County. This is the information for the local board of social service. It's located in Kozlowski Road and their hours. I apologize that I did not put the information for Ocean County, but that one is located in Toms River. And I got to tell you, Ocean County actually is wonderful in the respect that it has an email where members can actually email copies of crib cards, changes of address, and things like whatever, adding new family members, anything. Unlike Monmouth County still has not provided any of us with, if they do email, they don't have like a general public one that they share. So that's the information that I have so far. Diana? Yes.
It's Jenna. Can I ask, I don't see any questions in the chat, but can I ask Diana to do a quick Google search and put into the chat for the Ocean County Board of Social Services? I believe it's on Hooper Avenue, but it'd be great to just have the phone number at least and the address there in the chat for those who might need it. And then go ahead, Diana, you had something that you wanted to add.
The same thing, but I was going to say if she had the email too, I can jot that down.
Oh, I do have the email. I do, absolutely. I say it so many times. So the email for Ocean County, anything, any kind of services to anybody that has, it's usually geared to Medicaid. I have never tried to use it for anything other than Medicaid. Just letting you know, like, it's okay. So that one is going to be N as in Nancy, J as in Jack, F as in Frank, C as in cat for NJ Family Care, the @sign. And then it's going to be O for ocean. Let me see, I have to write it down. I'm sorry. O-B-S. O for ocean, B for boy. I got to write it down. I'm sorry. Ocean County Board of Social Services. There you go. I just said it. So it's O as in Oscar, C as in county, B as in board, S as in social, S as in social for social services, and then spell out the word ocean, O-C-E-A-N, and then dot
Hold on.
NJ.
Ocean. You had me at OCB, right? OCB?
Yes, SS
Got it.
dot
Ocean.
ocean,
Got it.
spell it out, dot NJ for New Jersey,
Okay.
dot US for United States.
Yeah.
So I recommend any parents, or anybody that needs assistance with a family member, or just make sure that when you send this, that you also include your case number.
All right. I'll post that for everybody in the chat.
Yeah, that's a fantastic one. I don't know, Ocean County is ahead of the curve with electronics, so that's great.
Thank you.
Okay. So whenever you guys are ready, okay, thank you. So this one is what Amerigroup offers. So basically, these are the benefits. This is how I say it to everybody. What's the differences between all the HMOs? Basically, the core health benefits are all the same, right? Because they're through New Jersey Family Care, and New Jersey Family Care is not going to give one HMO more benefits than another. The difference is the network. Okay, so with Amerigroup, you will be getting, our members do get medical care, primary care, prescriptions, dental, vision, pharmaceutical, and when people ask me what how services do we get, I pretty much just say everything that's a necessary what do you call it, service, medical service. So you'd be surprised what some things that are in there, that you may not have heard of, that are covered through New Jersey Family Care. So this is the basic core benefits. If we move on to the next slide, we'll show you all of Amerigroup's extras. So this covers benefits that are extra. So Amerigroup, one of the best things about Amerigroup is that we do not do referrals. Okay, no referrals for specialists. I believe 3 of the other HMOs do require referrals for specialists. I call it no permission slip. Okay, no referrals for specialists. If that mom has to go to that ENT to take her child, she's going to call an in-network ENT for Amerigroup, make her appointment, and go. She doesn't have to wait the 2 or 3 days that the insurance has to give this permission slip. Amerigroup is growing immensely in our network. We have an expanded provider network. Recently, this is in Mercer County, but recently we bought Capital Health in, which is like a huge network in Mercer County. So in Monmouth County, we do have, St. Barnabas, we do have Center State, we do have over in Ocean, we have all of the bigger players in our network right now, and we're looking to grow further with that. Let's see, Healthy Rewards. Amerigroup has a program called Healthy Rewards that we give a reward to our members for doing preventive health exams that they should be doing. So that is fantastic. We could go further into that later. I have a slide on that. Amerigroup also provides $100 for contact lenses. I don't know, I think we're one of the only ones, or if not, I'm going to say one of the only ones. It could be that there is another HMO that does provide, but I think we are like one of the top ones, or one of the first ones that had this. We give $100 to members for contact lenses. Glasses are covered. They can alternate between years for that. That's like a fantastic benefit. We also provide the free cell phones through SafeLink. So Medicaid provides cell phones. Basically, it's unlimited text. They get, with Amerigroup, you can get up to, I believe it's 450 minutes. I could be off by a few minutes. On their birthday, once a month, they get like an additional 200. And data is being covered, like almost up to, it's like a plus 1 gigabyte of data. So that's a fantastic thing for members that, can't have a home phone. So we cover that. We can move on to the next slide. Okay, these are the nitty-gritty of the Healthy Reward program. So sorry, I have to take my glasses because I'm doing this through the phone. So we have the gift cards. When moms go to their prenatal visits, they enroll into the Healthy Rewards, which is free of charge, of course. They can get a $15 gift cards when they go to their prenatals. They also get gift cards for postpartums. We also are diabetic members when they go for their retinal eye exam, and their A1C test can also get gift cards, $15 gift cards for that. Once you can see there, it says once a year, and the lead screening also gets a $15 gift card. So that's. Does anybody have any questions so far?
No questions.
Okay, we can move on to the next slide. All right. This one, there we go. This one is going to be the benefits we give our pregnant moms. So our pregnant moms, of course, don't need a referral for when you're pregnant. You have a lot of exams to do, a lot of laboratory, no referrals for much of that. Okay. So it's easy to do business with us that way. We do provide our moms with a double electric breast pump, specifically the one that the WIC office recommends, which is the Medela, I believe it's the Spectra S2 or the Spectra 9. There are other ones that parents can get, but those are the ones that the WIC office does recommend, and Amerigroup does provide them. Very simple. They call a number, our vendor that does it, that department will reach to their primary care doctor, get an electronic prescription. They pick out the pump that they want, and the pump gets mailed to them. So super easy. Let's see. Here, we just wanted to make sure there's a line there about enrolling. We help moms enroll, their newborns onto the policy, and we help our moms with appointments and counseling and birth control and all of this. Prenatal vitamins are covered. Women that are not pregnant, of course, can have their mammograms and their pap smears and all of these other health preventive measures. So that's like a little nitty gritty on the pregnant moms. This one is, as far as we know right now, we're like the only one that's providing this. Amerigroup provides, the program is called Value Added Benefits. In addition to the preventive health that you guys saw, the gift cards, Amerigroup realizes that moms and dads, right? It costs a lot of money to have small kids. So, you can't take the child out of the hospital without an infant car seat. Amerigroup provides that infant car seat to our pregnant moms. Okay. Very easy. We're not making them jump over hoops for it. All they need is two OBGYN visits while they're pregnant. They get the infant car seat. They do have to enroll into the program called Healthy Rewards, though. I must make a disclaimer on that, because we can't just push out to all pregnant moms. We got to make sure that they want it. Okay. So after mom delivers, she gets an umbrella stroller when she goes to her postpartum. When baby is born, baby gets 200 diapers. When mom takes him to his or her first 2.5-week checkup. When at the 1H mark with the flu shot, we give a gift card for that. For the flu shot at the age of 2, when they do their lead screening, we get 2 rewards for that, because that one requires a little bit more work. The mom has to go to the doctor's office, and then she has to go to laboratory. So she gets a gift card, as well as either a potty seat or a Brita filter. We just threw that one in, right, because it's lead. So if the mom already has a potty seat, she can get an option for a filter, a Brita filter. And then at the age of 3, 4, 5, and 6, moms will, when they take their child to their well visit, they can get a booster seat for their car. So this is a fantastic program that we have, and it helps parents immensely, especially during this time where, every dollar counts. So is there any questions on this?
Okay. They're great. These are great benefits, but no questions.
Okay, absolutely. Now, Marianne, are you going to do the Antworth, or this is my last slide and then you jump on?
This is your last one.
Thank you. Alrighty. So Amerigroup has many other services, such as we have a community support link. We call it, right now I think we're calling it a community link, which is right on our website. It's available to our members, and they can go in and find different things. that might be important to them. I mean, I know that there's plenty of CBOs out there that can assist with these resources, but we do have a direct link with a vendor called Aunt Bertha. And when you go in there, members can find things like housing, jobs, lawyers, where to find food, the closest, pantry, and much more. So this is a fantastic thing that we've added to our website, and as also a benefit for our members. We've had it for, I would say, about all through COVID. So at least 4 years. So I guess that's all that I have for now. Marianne?
Thank you,
Sure,
Wanda.
thank you. Thank you. Let me know how you can hear me right now. Good, perfect, thank you. Before I go to this slide, I know there may be a couple of people who joined us a little after the beginning. So if you did not have a chance to draw a picture of a pig, please do that now. Just take a piece of paper and draw a picture of a pig while I'm talking. Okay. Benefits and services we offer to our Amerigroup members. We do quite a few programs out in the community. So not just for members, but for the community as well. So you can see here, we have food distribution. We've done COVID testing and vaccines. We partner with other community-based organizations and federally qualified health centers to be able to do this. There's something that we've done in Newark with the organization called UCC. There's a free food truck that we've sponsored, as well as a community refrigerator, which is really cool. And we're hoping to do more of that down in Monmouth and Ocean County as well. If we could go to the next slide, please. Oh, and before I do that, we also do events such as diaper days, and that's what Wanda and I are at the event now. And if you can see behind me, I don't know if you can see behind me, we've prepared for our diaper day event. So we're giving out diapers, as well as collaborating with the Maternal Child Health Consortium, Federally Qualified Health Center, and one of the Family Success Centers here in Patterson. So those are some of the things that we're doing around the state. All right, so on the screen here, we have reading. Reading is something that is very important. There's a lot of studies that have shown that, obviously it's not just good for, education and knowledge. It also helps our mental and physical health as well. So we've supported virtual libraries. We were able to distribute books to over 15,000 students. We participated in Read Across America projects. So just so that you know, we are out in the community partnering, and we may be reaching out to you as well when we're in the area for hopefully one of these exciting programs that we do. Any questions for me before I go to the next slide?
No questions from the audience. I have a question though. What books do you provide?
Yes.
What are the topics?
They're not necessarily health related. They're just books that would be age appropriate for the students. So not necessarily health topics.
Okay.
Good question. Okay. So we also do health education. So I'm a certified health education specialist, and we have another health educator on our team who is bilingual in Spanish and English. And we provide virtual presentations as well as presentations in person. And on the screen, really small, but there are some of the topics that we offer, from nutrition, lead poisoning prevention, breast health, men's health, to kind of our mental health as well. I'm here. And stress management, conflict resolution. So those are some of the things that we offer as well. And we can come out to any organization. We do this for kids, for adults, older adults, people with special needs. So just know that we are available to come out and provide a presentation, and we will customize it. It could be 15 minutes, it could be an hour long. And how do you contact us? You're going to get, I see in the chat, you will get Wanda's contact information. You can do a screenshot, and hopefully Jenna could also share that with you. Reach out to Wanda, she will connect you with me as well. And we'd be happy to come out. Okay.
Marianne, I
yes.
just wanted to add that, I don't know if I didn't hear that. You would also do it like for staff.
Yes,
not just,
thank you.
Yes.
Thank you, Wanda. Yes, absolutely. We do presentations, professional development as well.
All right.
Okay.
I have a question.
So, yes,
You
yes.
mentioned stress management at some point. Sometimes during our coalition meetings or other workshops that we offer, we do like, you know, a breathing exercise, or we do like mindfulness moments and things of that nature, opening up an activity, or like for a half an hour, we ask, you know, our partners to sometimes work with us on that. Is this something that you all would be able to offer with us, to just bring some awareness to the fact that we're always doing so much
Absolutely.
and how to bring us back down before we start session?
Absolutely. Absolutely. And we're going to be doing that before I leave you today. So thank you, Jenna. We're on the same page for sure. For sure. If we can go to the next slide, please. Could we go to the next one, and then we'll come back to Wanda's contact information, because that's important to have. Okay, I'd like you to take a look at the pig that you drew. Everyone can take a look. Okay, so if your pig is drawn towards the top of the page, that means you're positive, optimistic. If it's in the middle of the page, you're more of a realist. If your pig is at the bottom of the page, towards the bottom, the day might be partly cloudy instead of partly sunny. Okay. Now, look at how your pig is facing. If your pig is facing to the left, you have a tendency to believe in tradition, you're friendly, and you're really good at remembering like birthdays, anniversaries. If your pig is facing to the right, you tend to be active, innovative, but you might be the one who forgets birthdays and anniversaries. If you drew your pig that's facing forward, you're totally good with it. And believe me, my pig is never going to be facing forward. Okay, now let's look at the details. If you drew your pig with many details, you're very analytical. You're thinking about every little detail in life and your day. You also can be cautious, and it might take you longer to build trust with someone. If you drew your pig with only a few details, you might tend to be more emotional. You look at the big picture. You might be a little impulsive as well. Okay, let's look at the legs. If you drew your pig with 4 legs, okay, 4 legs, you're very secure, you stick to your beliefs, but some people might call you stubborn. If you drew your pig with less than 4 legs, this could be a time of transition for you and change. Look at the ears. The bigger the ears, the better listener you are. So if your pig has no ears, that might be something we want to work on. And last but not least, look at the tail. The longer the tail, the more love you feel you have in your life. So if you have a little short tail or no tail, that's something you want to focus on going forward. Okay. So I hope that was fun. Some things hold true, right? And some things may not. This is a really nice exercise that reminds us that we all have a different perspective. We may experience the same thing, right, in front of us, but we will all have a different way of looking at it and reacting to it. Okay, so this is something we might do in one of our presentations. We try to be as interactive as possible. Typically, if it's an in-person workshop, we don't do a PowerPoint. We are, visual and interactive. What I'd like to do is our relaxation moment. So knowing that we all react differently to the things that happen during our day, something that can ground you is to think of one positive word. So if you want to, please put it in the chat. What would you like to feel for the rest of the day? I'm thinking for me, peace, some strength, and a lot of joy would be awesome. So those are mine. I have more calm, love it. I love the calm. Energized and cheerful, great. So just when you have, when we have negative events around us, whether it's words, things we see, even if we're watching the news, that negativity can increase our stress level. And then we have our regular stress that happens during the day. When you're grounding yourself with something positive, that is going to strengthen you to help you deal with the stress during the day. So I'd like us all to do this together. Think of your word. You can say it out loud or just think it. And we're going to take 3 deep breaths in and out. You can raise your hands up if you like I'm going to do. All right, ready? I see Wanda across the way. She's starting already. All right, let's take a deep breath in through your nose. Raise your arms up. And then push it out. I want you to hear yourself blow it out. Peace. Let's do another one. Breathe it in deep, calm. And push it out. Energized, cheerful, breathe it in. And push it out all the way. Take a moment and I want you to think about what, besides hearing me, what do you hear around you? What do you see besides your screen? Look away from your screen. Is there anything you smell? What do you feel? You could put your hands on your pants, see what your fabric feels like. Being able to take your deep breaths, ground yourself with positive thoughts, and be very aware of what is around you, stopping from what you're doing and relax you. So you can do this at night, drinking a glass of water before your breakfast, before your coffee, before your tea. Drink water, get your positive intention, take your deep breaths, be aware of the day and what you see around you. That's a nice way to start your day. And also, throughout the day, when those stressful times come, this will help you strengthen you so that you can deal with the daily stresses. It will help us mentally and also physically. It strengthens our immune system. So thank you for joining me in that little brief relaxation piece. And this is just a sample of what we do during our workshops. And if you would like to reach out to us, if you can go to the slide, the back one, Jenna, please, with Wanda's card. Great. This is how you can reach out to Wanda, email her, or give her a call. She will be available to be able to help any families who need help with New Jersey Family Care application or any questions you might have as well. And if you have anything health education related, she will send that information over to me. And if we can skip to our question slide.
No
Thank you
questions
so
in the
much for
chat.
having us.
Thank you, Marianne.
That's
Thank
great.
you both for your presentations, and you know, it's a manageable group right now, so if folks would like to take themselves off mute and have questions to ask, now would be a great time for Wanda and for Marianne. People love the activity. They're writing it in the chat. They're thanking you.
Oh, that's great. That's great to hear.
It's so funny that Diana, I saw you holding up your pig. Some people were texting me the pictures of their pig on the side. So it
Oh, that's
really
awesome.
gets
I'm sorry I
people-
couldn't see all of the pigs. Sorry.
Yeah, no,
I'm
I
sorry
think
for
it's
me.
great. Like I think it's amazing, and it's a way for us all to somehow connect. So that's great. So somebody asked, can we have a copy of the slides? Would you all be willing for us to share them?
Yeah, you know what, Jenna, if we can just send you an updated version with the updated eligibility, that should be fine.
Okay.
Yes. Absolutely. That'd be great. Right. Any other questions for Wanda or for Marianne?
Is there a script for the pig activity? Would
Yeah.
love to bring it back to
Yeah.
my team.
I know, isn't it an awesome icebreaker? It's just awesome. Just Google pig personality test. And I like going with the first one that comes up. I like, there's the best, because some of them have little variation.
Thank you, she said.
That's awesome.
If a family chooses Horizon, do they have to wait to switch to Amerigroup?
No, you can, if you have New Jersey Family Care, you can switch at any time.
So yeah, let
And
me
you'll
just
have
add
to
to that.
call. Yeah. I'm sorry, I'm glad you're there, Wanda. I thought you stepped away. Go ahead.
No, yeah. Let me just see. Am I here? Yeah. So yeah, no, absolutely. So New Jersey Family Care will allow families to switch for any reason related to their doctor. So basically, if the doctor takes Amerigroup, then they could definitely call and say, you know, I would like to switch. My children's doctor takes Amerigroup. That's it. And they'll allow it. If you want to send me the family so I can go through all of the benefits, that would be, I'd usually like to make sure that all the doctors are covered before they do any switching. That way they won't, you know, be disappointed. I mean, not that I think that they would be, but just in case, I always like to cover that. So if any of you guys would send me your customers, I will definitely go through it to make sure everything is checked off their list, their dentist, their, you know, if mom has an OBGYN, their primary care doctor, the pediatrician, all of that. And then I directly give them the information to NJ Family Care so they can get that done. And I'll let them know when it starts. If you usually do it before the 15th of the month, they get on for the following month. But if you miss the cutoff of the 15th and it's not guaranteed for the next first of the month, it might take them a month and a half. But I always assure families that they do not lose their coverage. I'm like, it's like changing houses. One day you live in this house, the next day you live in the next house. So.
Thank you.
I have a question. One of the families that I was working with said that they applied for New Jersey Family Care and they were just waiting to see if and when they'd be approved. And so is there a timeline on the process for approval?
So there is. New Jersey Family Care usually says, excuse me, they usually say like 45 days. It's something like during COVID, it got sped up. I don't know if it's because people were working from home, but it got sped up to about 3 to 4 weeks. So literally the first day you apply, a week later, you get a letter saying, hey, we received your application, we're processing it. 2 weeks later, you get a letter saying, Please provide us with your income and any other supporting documents. The parent sends that in. Roughly the 3rd to 4th week, they will get something from New Jersey Family Care saying, you know, you got it or you don't have it. That would be it. It's taking less than a month. So I always tell parents, if you don't hear from them in about 3 weeks, call me, because something is not correct. Either they missed the mail or, you know, that happens often.
Okay, great, thank you.
You're welcome.
Does anybody else have questions for Marianne or for Wanda before we wrap things up? Okay, so we can get you some follow-up information, and we thank you again, Amerigroup friends, for being with us and doing this presentation. When it comes to cancer and chronic disease prevention, it's always important to know about the health presentations and the social determinants of health programs you're working with in the community, to just be able to have this resource at our fingertips to do enrollments is really helpful for the families that we work with. So thank you, thank you. And just one additional announcement from OMHA Monmouth Health Alliance is that, again, we are doing this series once a month. And so the next one will be on October 26th at 10 a.m. And we'll be hearing from the Visiting Nurse Association Community Health Centers. So those are our Monmouth County VNA friends who do offer through their federally qualified health center prevention, prenatal, specialized services, all related to healthcare at affordable costs. So we look forward to having them as our guests next time. But thank you all for being here. And again, thank you, Amerigroup, for being our presenter this time around. Have a wonderful, wonderful day, everybody.
You're very welcome. Thank you. Have a great day. Bye-bye.
Thank you.
Thanks, Jenna. That was great.
So you feel, oh, let me record, stop recording.